Welcome everyone to today's webinar. My goal for today is, these are the stuff we have on our agenda. You want to look at the skin pyramid, skin anatomy, learn about different ingredients in your skincare line. But in reality, my hope is very simple. I hope that after today's talk, when you go to pick up a skincare line, if you look at your lotion, your moisturizer, even your shampoo, when you look at the back label with the ingredients, at least a few of the ingredients, all those fancy chemical names, make sense to you. Because the truth is, every day we're all bombarded by all these commercials, people claiming that their skincare line does A, B, and C. Some of us know our skin and we know that sometimes we're too sensitive. Some people have an oily skin. Some people have dry skin. Some people don't like a specific type of moisturizer or sunscreen, but we don't really know why, right? My hope is after today, some of these ingredients are going to stick with you. So you know, if you're sensitive, you want to look for a moisturizer or a skincare line that includes certain types of ingredients, or avoid certain types of ingredients if, for example, you have a dry skin or an acne-prone skin. That's my goal. But this is the structure of today's talk. We're going to talk about skin anatomy. We're going to talk about big picture of what ingredients are included in skincare lines. And we're going to talk for the most part about different types of moisturizers, different types of alpha hydroxy acids, and how they help you fight aging. And at the end, Julie is with us. Julie works with Young Pharmaceuticals, and they are in charge of all the behind the scene actions. They make our products and make it available to all of you. These products are, majority of them available online, or if you've ever been to our office, you know that these are the products we use on our own patients, and you might be familiar with some of them. On that note, let's talk about this pyramid. I like this pyramid because it emphasizes the importance of different ingredients. On the very bottom, the base of this pyramid is a broad spectrum sunscreen. This is by far the most important ingredient in skincare regimen. Sounds kind of funny, right? The simplest, the cheapest skincare line out there, the cheapest thing that you can get for your skin, but also the most important thing. Because as we all know, sun does damage. If you live in California, you don't need me to remind you. Now, a lot of people think they are compliant with their sunscreen because they put it on their skin in the morning, then they come back at night and they hope that it covers them the entire day. The truth is, a half-life of sunscreen, regardless of their SPF number, is about 90 minutes. So in order to be compliant with your sunscreen, you have to apply sunscreen every 2 hours. Otherwise, what you put on at 7 o'clock in the morning and you went to watch a game is not there in 3 hours. Not to mention, it takes about 30 minutes for it to get activated on your skin. So my patients, I always tell them, especially those that come in for a laser procedure and they really want to preserve that result. They're like, Dr. Hakimi, I love my skin. How do I prevent it from going back to pre-treatment condition again? I tell them, you keep a sunscreen in your purse, one in your car, one at work, and one at home. I don't really care what brand you use or what SPF. Pretty much anything over SPF 35, 40 is the same. What's more important is how often you put it on your skin. Find one that you like. Some people like oilier ones, some people like drier ones. I don't care, as long as you put it on every 2 to 3 hours. Now, higher on top of the sunscreen, you see retinoids. Some of you are familiar with retinol. Some of you know retinoic acid and retinoids, or retin A. All of these are derivatives of vitamin A. They act as a stimulant for your stem cell line. Retinoids make your skin make newer skin faster. You see, a baby's butt is soft not because babies have a very moist skin. It's because babies make new skin cells every 5 to 7 days. By the age 45, 50, we're making new skin cells every 25 to 30 days. So you can see how the old skin lingers around much longer and it piles up a layer and layer on top of each other. What a retinoid and retin-A products do, they make your stem cells make new skin cells faster. You can make it up to 7 to 10 days. So it's a dramatic improvement from making new skin cells every 25 to 30 days. Now you're down to 10 to 12 days. That's why those of you who are on retinol or any sort of retin-As, you've noticed that after 2 or 3 months of using it, your skin has that glow and that pinkness because you're constantly making new skin cells. Now, moving on top, hydroxy acids and antioxidants. These are important because what they do is they thin the outer layer of your skin. You remember how I told you the old skin stays and lingers around and just piles on top of each other? What these alpha hydroxy acids and antioxidants do is they thin out that outer layer. It helps in 2 ways. When you thin out your old skin, your new skin starts to show, so it looks better, it feels better, but also they make your skin more susceptible to treatments. So using alpha hydroxy acid makes the retinol, the sunscreen, the growth factors, all of them penetrate deeper and easier into your skin because all the barrier is thinned out. At the end of this talk, you're going to hear Lindsay talk and use some of our growth factors and stem cell line. And I can assure you that using something with hydroxy acid prior to that makes your skin absorb them much easier and much faster. Now, on top of this pyramid are what we call supplements. They polish your skin. These are the lotions and moisturizers that you frequently use. Now, they're not always so adjunctive. Some people with specific skin conditions like contact dermatitis, moisturizers are actually therapeutic to them. Now, everyone else, even those of us who don't have any skin conditions, we get dry skin all the time, and that's where moisturizers come into play. In a few slides, I'm going to go over different types of moisturizers and which ones suit different types of skin conditions. This is a slide, a pathology slide from a cross-section of your skin. If you can see my mouse, this curvy linear area on the bottom is your stem cell line. Don't worry about these fancy names. Let's just skip to the last layer on top, stratum corneum. This stratum corneum is the dead skin cells piling on top of each other. This is the layer that we want to thin out as much as possible. When you get a chemical peel, it's this layer that's attacked. When you put alpha hydroxy acid, it's this layer that's thinned out. When you put retinol or retin-A or all those growth factors, however, they work on this stem cell line on the bottom of your skin to make these cells make new skin faster and push the old skin out. Now, almost everyone needs to be on some sort of retin-A retinol, right? Or alpha hydroxy acid. We covered what they do. They thin out this top layer. And by removing this, they also stimulate your skin stem cells to make new skin faster. Living in California, just having old skin or older skin cells on top of your skin is not the only problem we have, right? Majority of people complain about sunspots and dark spots on their skin. That's why majority of my patients, not only we put them on some sort of retinol skincare line, but also we add some bleaching agents. Now, it doesn't mean you're going to be bleached to chalkboard or whiteboard white. What bleaching agents do is they inhibit the enzymes that make melanin. They inhibit the enzymes that make pigments in your skin, and they make your skin lighter. And those are the stuff like hydroquinone, kojic acid, or as you will hear later, arbutase, which is a derivative of hydroquinone with specific advantages that we frequently use. Now, this is, if you had to spend money on one skincare line in California, I would say that needs to include two very basic ingredients. You need a skin lightener and you need a vitamin A derivative. If you've listened to the last few slides, you already know why. Because skin lighteners keep your pigments at bay and prevent darkening due to sun exposure. Or if you have sunspots from inevitable sun exposure, they make them lighter. And the retinate products, they make your stem cells make new skin cells, so you have a higher turnover time and you get more new skin faster. As you've noticed, these are color-coded and there's a reason behind it. Hydroquinone is the strongest bleaching agents available. That's why when I start my patients for the first time, or if I'm preparing them for a CO2 laser or a chemical peel, I give them a skincare line that includes hydroquinone, but I warn them that it could be irritating for the first couple of months. And I only use it for 2 or 3 months. When their skin starts to get better, then I de-escalate the treatment to a non-hydroquinone bleacher, such as arbutase or kojic acid, because they are easier to comply with. Same thing with the Retin-A products. You see they come in different flavors. Retin-A is the strongest one. It makes your skin sometimes red and flaky. Those of you who've used it, majority of people stop using them because they think they have an allergic reaction or it makes my skin too dry. I don't do well with Retin-A. The truth is your skin is not used to working that hard. That's why for the first month or so, when people get on a Retin-A regimen, they always look a little red and flaky and dry because your skin needs to get used to that level of activity. Always after 2 or 3 months, as you can see in the graph there, after about 4 to 6 weeks, your skin starts getting used to it. You come into this blue phase, and then as long as you continue using it, it's very rare that you stay dry and red. Your skin gets that glow, feels softer. And majority of my patients say, I have to use much less makeup because my skin already looks very good. Now, more on the whole Retin-A, retinol topic. As you can see in this graph, there are certain products that you can buy over the counter. Retinol is something you can buy over the counter. Retin-A, however, you need a doctor prescription, because as you go to the right side of this chart, these products get stronger and more irritating, as you can see on the y-axis. And that's why you need to consult with the doctor and have a prescription to obtain any of the stronger products. But any of these like vitamin A and retinol, you will be able to buy them over the counter.